Hello all, welcome to Polly Hipster. Today we will be addressing a very common question that most of us have: when to consider medical advice for belly fat loss. Most of us wonder if we are healthy enough, how to recognize unhealthy fat, should I start dieting, when should I start dieting, have I gained excessive weight for my frame, should I consult a doctor? So, in order to understand whether the weight gain is healthy or unhealthy, we should understand the following things. What is fat? Are all fat harmful? So, fat is a type of nutrient that we all need to consume to live. It is very important macronutrient that is required for proper functioning of our body. They help store or carry different things in our body. And also, fat is stored either as peripheral or as visceral fat. Now, this is where it is important to understand. What is visceral fat? It is a type of fat that is stored in the abdominal cavity, also known as active fat. It is located near several vital organs such as liver, pancreas, and intestines. And this fat is deeper and not visible from outside. So the one which we can pinch, this is subcutaneous fat, whereas the fat that is present inside, near the organs, surrounding the organs, is the visceral fat. Why is visceral fat a health concern? So visceral fat, they are metabolically active and they can produce hormones and other inflammatory substances. And they affect various organ systems of our body. Let's see how. Starting with the cardiac system, they produce increased cholesterol levels, they increase hypertension and risk of heart disease. Whereas they cause insulin resistance, higher chance of insulin resistance, leading to diabetes mellitus, type 2 diabetes mellitus. They can also further lead to complications such as metabolic syndrome. Excessive accumulation of visceral fat can also predispose breast and colon cancer, and they can also lead to further inflammatory conditions. So, how do we measure and diagnose the presence of visceral fat? First parameter being the waist circumference. If we consider an average male and female as per WHO standards, if the waist circumference is more than 40 inches in males and 35 inches in females, we can suspect the presence of visceral fat accumulation. Next parameter of measuring is CT scan and MRI scan, that is various imaging techniques. Next comes the DEXA scan, which is dual energy X-ray absorptiometry, where it is a non-invasive procedure that estimates body fat percentage. It can also measure lean mass and bone density. Finally, the less invasive method, that is ultrasonography. So, what are the different causes for visceral fat accumulation? Starting with the genetic factors, where in some individuals there are some genes expressing or some family inheritance, familial traits that can cause excessive accumulation of visceral fat even with a healthy lifestyle. Such factors are very difficult to modify. Then comes the most common factor, which is dietary factor, unhealthy dietary factor, where high sugar, trans fat, and alcohol consumption is associated with excessive visceral fat accumulation. Then comes improper eating habits where large portions are consumed at a time, improper meal timing such as excessive late night snacking, etc. Then lifestyle. A sedentary lifestyle predisposes excessive fat accumulation. Then high stress levels. These are all modifiable physiological causes. Then comes pathological causes like hormonal imbalance, where decreased insulin, estrogen, and testosterone levels, also decreased thyroid levels, can cause excessive visceral fat accumulation in the body. Now, what diet should be followed? This is a very common question. People are following different types of diets. There are different famous diets such as keto diet, Mediterranean diet. So, what exactly should we follow? The whole concept of diet has become very stressful nowadays with a lot of opinions, lot of strategies and plans. But to be honest, it is just simple if you understand what to eat and what not to eat. Starting with soluble fibers. So instead of taking processed foods, try including high amount of soluble fibers in your diet, which includes oats, flax seeds, avocados, legumes, Brussels sprouts, etc. And decreased consumption of refined carbohydrates and sugar, such as flour, that is maida, or any sugary syrups, cold drinks, etc. It is better to avoid all those things. Then increase consumption of monounsaturated fatty acid such as olive oil, nuts, avocados. Then omega 3 fatty acids, fatty fish, walnut, flax seeds, including lean protein in your diet such as chicken, turkey, fish, tofu, legumes, etc. These are the things. So you can prepare a meal which includes one of these things every day as per your liking. Next comes portion control. Control the amount of food consumed at a time. Consume small portions of food at a time, and you can consume at least 4 to 5 meals in a day every 2 hours. And meal timing. It is better to have your last meal of the day at least 4 hours before sleeping. When to start and where to start is the most troubling question that most of us face, which further leads to procrastination and further delay of adoption of a healthy lifestyle. So, here are a few practical tips. First, start gradually, small steps at a time. Set small goals for yourself towards a healthy lifestyle. It will make things much easier and give you a feeling of satisfaction and improvement. And thus, you can encourage yourself further. Next is read the labels properly. Know what you're buying. Be mindful of what you're eating. Next, adopt a lifestyle where you mostly consume homemade food. Try preparing meals at home itself. Healthy meals, so and especially the ones that can be stored and carried with you over a week. So it will be easier for you to be healthy, and also it will save money and you will avoid outside food. Mindful eating. Be mindful of the proportions of food consumed at a time. Never go a long time without having food. In that case, you will end up being very hungry and then you will end up eating a lot of junk food for that satisfaction. So, it is better to keep a healthy snack always with you and always be half full. Keep your stomach half full so that you will not have excessive sugar craving due to hunger. Last is stay hydrated all the time. Then, regular physical activity is very important, especially aerobic exercises such as running, cycling, etc. That will help with fat loss rather than muscle building activities. When to consider medical advice for belly fat loss? First is if the BMI is of concern, that is body mass index, if it is more than 30. Then, if the person has any associated health risk factors, or if the person is struggling with lifestyle changes and it is hindering their day to day activity, or in case of family history or genetic traits associated with excessive fat accumulation, which is now affecting their health and day to day activity, seeking professional help would be of great importance, which include prescription medication, bariatric surgery, and liposuction. That's all for now. See you soon with more videos.